Welcome to the To Your Health podcast, your go-to source for everything health, wellness, fitness, and the latest in medical insights. I'm your host, Rhonda Alford. Joining us today is Dr. Deanna Blanchard. She's a family medicine physician and a culinary medicine specialist at the Terrebonne General Multi-Specialty Clinic in Gray. Welcome to the show, Dr. Blanchard.
Thank you for having me.
So glad you could take time out of your busy schedule to join us today.
Of course.
Why don't we get started with you telling us a little bit more about yourself?
Sure. So I just joined Terrebonne General. I'm a family medicine physician out in our Gray clinic. It's a multi-specialty clinic. So I see patients, mostly adults, for chronic care management, chronic disease management, and my passion is really preventative medicine. I recently got certified as a culinary medicine specialist last year, so I'm very passionate about nutrition and incorporating that into my counseling with patients.
What a very interesting subject to talk about, and I can't wait to dive right in. So, how does food help keep you healthy?
I think from my perspective, I see, well, we see a lot of chronic diseases. You know, our biggest diseases are cardiovascular disease. Most of us, if we live long enough, will have some level of cardiovascular disease. We know the disease processes that contribute to that are things like diabetes, prediabetes, obesity, many of which are food associated, lack of exercise associated, and sometimes very preventable. So nutrition plays probably an essential part of both prevention of those disease processes and managing them once they're a part of a patient's diagnoses, I guess you would say.
So, it can play a huge role
Absolutely.
in whether you're healthy or not so healthy, it seems
Correct. And
like.
it's also helping patients, manage not only from a medication perspective, but what they can do at home to try to improve their disease processes.
How does proper nutrition support immune health?
Our immunity, I think we saw that a big part of that during the pandemic. We were seeing this association, and obviously, when we would rate patients who were getting sicker, most of them had comorbidities like diabetes or obesity. And we learned at that time that some vitamin deficiencies, vitamin D was a huge one, that plays a key role in our immune health. Many patients were depleted in some of those, and their outcomes in that particular disease process were worse because they were less healthy, so to say.
So, it's very important to have the right vitamins, the right nutrients. How do you
Correct.
work with patients to incorporate nutrition into their care plan?
If we're looking at something like hypertension, statistically speaking, 1 in 2 of adults in this country have high blood pressure. So you can get a 10-point reduction in your blood pressure with nutrition alone, something called dietary approaches to stop hypertension, or what we call DASH. It's based on Mediterranean style nutrition, which there's a lot of evidence. So most of what I promote is evidence-based. But we know that we can improve things like hypertension, diabetes, with shifts in nutrition at home. So DASH is really just promoting lower sodium intake and reading labels and hopefully eating more whole foods and less processed foods is kind of the goal.
Is that what the Mediterranean diet is?
Absolutely.
Tell us more about,
Yes.
what it focuses on.
Mediterranean has been around for a long time, and it's basically focused on vegetables, fruits, whole grains, increasing fiber intake, healthy. Beans are actually a great source of protein, so it promotes, I would say, higher fiber, more nutrient dense foods that give us those vitamins and minerals that we need. Also healthier proteins, leaner proteins, low fat dairy, moderate alcohol intake. So it hits a lot of key points. And we know that patients who have higher Mediterranean diet scores have better health outcomes.
Isn't it like that part of the world where this diet is pretty much what they do every day. Isn't that true for the regions that they live in? These people are living longer, they're healthier.
Yes, that's
Mhm.
correct. I'm sure most people have heard of these blue zones. There's a lot of studies being done, but most of the studies originated in the Mediterranean area. And they started looking at why do these patients have lower cardiovascular risk. And part of looking at it was they were eating very highly nutrient dense foods. A lot of these areas are sourced around coastal areas. Interestingly,
Yeah.
as we are here, they have high access to fish and seafood, fresh vegetables that a lot of them grow at home. So, more nutrient dense food accessibility.
And you were telling me some statistics about Louisiana and their population. Why don't you share those with
Yes,
everyone?
unfortunately, our Louisiana Department of Health just published last week that Louisiana has unfortunately been rated in the lowest five of healthy individuals in the country. So we have about 45 to 50% obesity rates in adults in this state alone. This information, getting more active and trying to promote healthier nutrition, can really have impact on that, improving that, I should say.
Yeah, we need some help. We need to get
Yes.
a little healthier. How do you work with your patients, and what are some of your go-to recipes maybe that you share with them?
Yeah, so sometimes I'll cater. I try to throw in, our time is limited sometimes with counseling ability. So in some cases, potentially with my diabetic patients, thankfully at Terrebonne, we have some amazing dietitians here. So I will refer appropriately when I feel like they need more intense dietary recommendations. But if I have a few minutes and I'm seeing a patient for hypertension or diabetes or oftentimes obesity, I will usually give them some handouts to take home, often based in Mediterranean. And then I don't so much focus on specific recipes, although I do have a stack of healthy recipes. I focus more on keeping it simple and promoting more vegetables, more fruits, more whole foods, leaner proteins, and preferably less processed food.
And you were mentioning there's some new terms that they're calling for places that don't have access to a lot of fresh foods and vegetables.
Yes.
Tell us more about that.
Yeah, so in the culinary medicine world, we have a couple of terms that I think are interesting. And a lot of research is getting done on these areas. So actually, food swamp came out in
Mm.
2009 by some studies that were done through the University of Michigan based on food access in New Orleans. So a food swamp is considered an area, a geographic area that has a lower nutrient dense access to foods and higher caloric nutrient low foods. So places like high fast food areas where people are more prone to stop, partly
Mm.
because of advertisement, convenience. A lot of families are really busy these days. So
Right.
if you have a mom driving home kids from school or going to practice, the kids see the restaurants and they want to stop there and eat. Plus, it's convenient.
Right.
So the other term that we use is a food desert, and those are places that really have low access to nutrient dense foods. So potentially they don't have a grocery store in town to get foods. We do see a correlation with higher obesity rates in food swamps, which makes sense because they have higher access to the higher caloric foods, whereas in a desert, I find, especially in South Louisiana, I think our rural areas, we eat more from the land, right? So we fish, we eat things like deer meat and rabbit and things that we can hunt and fish.
Well, how does culinary medicine differ from traditional medicine?
I wouldn't say it differs. I think it's sort of an enhancement of medicine. So, unfortunately, most of us in medical school did not get a lot of nutrition education. And so, it allows us as providers and healthcare nurses, dietitians, to have evidence based information on nutrition and how we can pass that along to our patients. And their disease processes. So everything from, our cancer treatments, nutrition is really important, high
Mhm.
blood pressure, diabetes. So it gives us the resources to incorporate with our day-to-day medical management.
Like taking it a step further.
Correct.
So
Yes.
food can be considered medicine, is that correct?
Yes, I'm glad you made that point. I think that is a key phrase these days that we had kind of gotten away from a long time, and I think most patients that I see, they want to decrease their medications and they want to learn ways to be able to do that. And so, healthier food intake is one way to help them decrease their medications. And then
Yeah.
sometimes getting off of medications, which is always a goal
That is
for most
amazing.
patients.
Yeah, that is amazing when you can get off your blood pressure medicine, get off your other medications that, you know,
Yes, it's our goal. It's usually, I always say this to patients, it took a long time, for us to get to where we are in our disease processes often. If I can reach a younger patient that really doesn't have any chronic diseases yet, I can
mhm,
really prevent some of that from happening. And some of our older patient populations that are already living with some of these disease processes, getting off of medication completely is not always an
yeah,
option, but definitely reducing medication,
right.
and they work hand in hand.
That's a huge cost savings as well.
Cost savings, and also just I think it's quality of life. It's a quality of life issue, so if you can feel better every day, then I think we all want that. If we can move better and feel better, I think
Yes,
we all
live a
want
better
that.
quality life. Well, real quick, tell us what kind of patients you see at the multi-specialty clinic in Gray.
Sure. So I see mostly adult patients
Okay.
at the multi-specialty clinic. We have three primary care providers. Um, I practice family medicine. We have Dr. Arsenault, who's internal medicine, Allison Bacheron, who is family medicine as well. She's kind of shifting more into endocrinology. So in our clinic, we have an endocrinologist that comes, Dr.
Perfect.
Vanderoos. She does actually weight management. So she's there once a week. And then we have our pulmonologists that come in. So I see adult patients for preventative and chronic care management.
Well, thank you so much for sharing all this helpful information with us
Sure.
today.
Thank you for having me.
All right. For more information about Dr. Blanchard and Terrebonne General Health System, visit tghealthsystem.com. Don't forget to like, share, and subscribe to this podcast where you get your podcasts. Thanks for joining us.